Good afternoon, everybody. We are coming to you from a different time, but this has been a different week. A different week in that we had the State of the Commonwealth and State of the Budget, but also a different week because we witnessed a domestic terror attack on our U.S. Capitol that has now led to the death of one of the Capitol Police officers. To that family, we are thinking and praying for you. To those terrorists, no, never again. What you're doing is not patriotic. You are terrorists. Cannot be allowed. Every elected official, every leader that's out there has a duty to this country, a duty to their faith and values. We are all responsible for our words. You cannot fan the flames and condemn the fire. Our country, we all care so much about. But what we saw on Wednesday and what we have seen in other states and even what we saw here not too long ago on our Capitol grounds, those are attacks on our country intended to intimidate and create terror. We will not be intimidated. We will not back down. So no more supporting these groups. No more blatant hate and disrespect in the way that we speak as leaders. That cannot be allowed. No more questioning people's elections. Now ought to be the moment and the point where we restore our democracy, where we remember that being Americans is more important than being Democrats and Republicans. Your most important team is this country. And don't think you're for this country if you've just attacked our U.S. Capitol. So today's briefing is primarily about COVID, but then we will take questions on anything ranging from a domestic terror attack to legislation that's going through our General Assembly right now. We will talk about the piece that's related to COVID on that to any other questions that folks may have. We are at a really tough point once again in our war against COVID-19. We have successfully stopped 3 waves of this virus, but we are now seeing a real and significant increase in cases and our positivity rate from people's gatherings around the holidays. I wish it hadn't happened. And we got to make sure that moving forward, we are not gathering in that way. And we got to be real careful with as much virus as out there. And I'm going to show you some statements that the White House has made in their most recent report to us. But we've got to know that we wear a mask now to protect ourselves. You have to assume if you're indoors with other people that someone has the virus, and you need to be wearing that mask outside of your own household. It's gotten that significant, and these mutated versions appear to be spreading really fast. So the new White House report that has come to Kentucky, I want to go over a number of statements that we are seeing an increase in both new cases and an increase in our positivity rate. And that this surge that we're in right now is at least twice the rate, the seriousness of the previous surges that we have seen. This is our most dangerous time. This is not the time to take away our ability to fight this virus. This is the time when in that period that we are in, that we could lose the most people, that so much of our progress could be torn away, that our sacrifices could be thrown out the window. Next piece. The White House is now telling us that the acceleration we are seeing across the country may well be a U.S. variant that has evolved, somewhat like the one that you are hearing about in the UK, which may be 50% more transmissible. In other words, we are not only in a dangerous time for the amount of virus out there, but the virus may be more dangerous in terms of its spread than ever before. And while that might not mean that any one case is more serious, if there are that many more cases, and we lose 1% of the people that get infected, we will see more death and more devastation. Next piece they talk about is that aggressive mitigation must be used to match a more aggressive virus. In other words, states have to have the tools to react and to put in place, when needed, the steps that we know reduce the spread. We've shown the Commonwealth that 3 straight times. It includes uniform implementation of effective face masking, which we've been able to do through executive order, strict social distancing, and without the ability to enforce that, again, we're going to be in a very concerning place. White House is also looking at some of the same vaccination challenges we are, that we've got real good news in that area. They're recommending the creation of high throughput vaccination sites. And we are actively working on this right now. I believe Louisville is beta testing one at the moment, where we can get thousands of people through every day in a site that can operate day after day after day until the day we defeat this virus. We're going to want to make sure that when we're operationalizing this, it is regional. And so every region of the state has real access and ability to get this vaccine. They also are concerned about vaccine hesitancy. It's real. We're seeing it in some of the staff members in long-term care. And so they tell me and Dr. Stack and others to continue to message about the safety of this vaccine, 95% effective, and to take it ourselves and to televise it and to show people that it's safe and we're willing to do it. More than that, I'm willing to have my family vaccinated. My wife, Brittany, has taken it. I would never have recommended that to her if I did not believe that it was fully safe. We have real vaccine hesitancy that we're going to have to push through. Again, it is now so prevalent, this virus, that the White House is saying that if you have been around anybody outside the household you live in over the holidays, you need to get tested now. We have over 350 testing sites across Kentucky. You can get on kycovid19.ky.gov and sign up now. If you visited with friends, if you went to extended family members that don't live in your household, you must get tested. We need you to do it. Federal report also went through where we rank on some different things across the country. We are 29th in the highest rate for cases. When you look at our neighbors, it's pretty good comparatively. And again, it's hard to be any better on this list when we have so much virus around us. This is the one that we ought to feel very proud of. In one of the most unhealthy states in the country, we're 41st in new deaths. In new deaths. That's not just overall. This is how well we are taking care of our people. This is what we see in our sacrifice. This is going to be shown through the steps we've taken. When we've asked some to sacrifice even more, typically economically, it's paying off. It's paying off in less death to our people. This last one is obviously the most concerning. Our positivity rate is significantly increasing. And that is a real worry that should set off alarms with all of us. We're now up to 19th in the country. We are increasing when we were previously decreasing or perhaps even plateauing. All right, and some good news. Northern Kentucky has been hit really hard recently by this virus. Cincinnati, of course, hit worse. And in Northern Kentucky, we are now moving a federal surge testing to provide I believe this is the 3rd testing location in Northern Kentucky. The other 2 run by St. Elizabeth's. So beginning on Monday, January 11th, in the Covington West IRS parking lot, the federal government, in partnership with us, is going to be providing additional testing for residents of Northern Kentucky. You can register at doineedacovid19test.com. So to our officials, our communities, the media up in Northern Kentucky, please spread this far and wide. It's open. The portal is open now. People can sign up. We want to make sure that it is full beginning on Monday and that we take advantage of this real help that we are grateful for from the federal government. Going to move now to Vaccines, also some good news. So on Monday, Dr. Stack and I talked about how the speed that we were vaccinating people in Kentucky wasn't acceptable, that we had to push harder, and that we were going to provide a new goal and new guidance to do that. I could tell you since that day, it's picked up measurably. Today, the total doses administered here in Kentucky, 107,799. So on Monday, we were at about 66,000. These numbers don't include half of yesterday or today. More than 47,385 vaccinations in the last 3 days. Now, we've got to pick up our pace even from here, but that shows that providers saw the guidance. They got clarity in that if we can't find any more people in 1A at the moment, what do we do? And now they have, I think, the instructions to where we can truly reach that goal, we hope, of 90% of all doses received put in somebody's arm in the first week. And this is even more critical with the virus and how it appears across the country to be escalating. Of course, my hope is we're seeing a bump from Christmas that won't continue to grow. But in a minute, we'll report that today's our third highest day ever. Of course, the last two highest days were the last 2 days. So cause for concern that we will be watching closely. We're next going to have 2 reports on our vaccination efforts. Dr. Stack is going to talk about our healthcare worker vaccination efforts and give a resource to those workers that have not received a vaccine yet. And then Adam Mather from our Cabinet for Health and Family Services is going to talk about our long-term care program. And we got Dr. Stack for the first time in a while here with us.
Thank you very much, Governor. It's nice to actually be here in person. It's a lot easier to talk to the camera straight. James, could you please put up my slides? I'm going to show you 4 slides today. These are going to have to do with vaccine rollout. 3 of them we have already previously shared with you. The first one are the phases. So on Monday, this past Monday, January 4th, Governor Beshear and I announced all 4 phases for the vaccine rollout in Kentucky. Phase 1A, healthcare workers and long-term care facility residents. Phase 1B, which is K through 12 teachers, first responders, and people 70 and older. Remember, we gave the rationales for these. We need to get our kids back in school. That's absolutely essential so they can get back to learning. And so parents have their children in a safe environment where they can be out working and doing their jobs. Immunizing the adults in the building is a way to open those schools as safely as we possibly can. We also need to get to the individuals who are 70 and older. 75% of the people who have died from COVID-19 in Kentucky are 70 and older. That's another reason why we work so hard to get the long-term care facilities. And then the first responders, obviously, we rely on to keep us safe and protected and help respond in our time of needs. And I think all of us have understood the importance of getting these populations. After that, we announced on Monday phase 1C, which is the rest of 1B as the CDC defined it, plus parts of the next phase in the CDC plan. That would capture all of the folks who are in the CDC bucket for either essential worker category and those people at most high risk for severe COVID disease. Anyone with the conditions that the CDC defined on its website at the time that we published these guidelines, these phases, who has health conditions who are proven to result in more severe disease. And that's for anyone 16 and over who has any of those highest risk conditions. When you move to phase 3 and phase 4, at that point, we're talking about healthy individuals who do not meet any of the other criteria. And then it's an age-based tiering, where you go to people between 40 to 59 for phase 2, and then phase 3, it would be 16 to 39 years of age. We won't get to the phase 3 as soon as probably until sometime in summer, and phase 4 is not even eligible for the vaccine now because the vaccine is not authorized for anyone under the age of 16. If we could go to the next slide, please. The slide that describes all of the folks that the CDC has defined as essential workers is on the left side of your slide, and on the right side are those health conditions that the CDC has defined as being proven to elevate your risk for severe disease for COVID. Those are taken directly from CDC materials without editing. And what we would ask any vaccine administration site to do is to follow those. If an individual says, I'm in those categories, then we would honor the person's request and we would offer them the access to the vaccine if we have the doses to give. And then if we could show the next slide, James. This next one is really important. A shot that sits in a freezer for an extended period of time is no use to anyone. And because it is incredibly difficult to find people who meet very specific, very discrete descriptions, it's hard to locate all of them. And because, unfortunately, there's a substantial proportion of the population who is opting to wait for the vaccine later or has some concern or hesitancy, it's very difficult because when we allocate certain proportions or numbers of vaccine for specific purposes, not all of the population always accept the vaccine when offered initially. And so for this reason, it's absolutely important that while every week a vaccine administration site starts at the top and works from 1A to 1B to 1C, and they go in that order, always trying to reach the highest priority people first, and always promoting to the people in only the open tier, that at the end of the day, every week we want every vaccine administration site to give 90% or more of the vaccine that reaches the state within 7 days. So the goal is a willing arm is a ready arm to receive the vaccine, use the vaccine, give the vaccine, do your very best to target and reach the highest risk individuals as defined in the phasing. But at the end of the day, every week you should use all the vaccine you receive to the best of your ability. And then next week, if you get more, then we move forward and we keep that process up until we get to everybody who wants to be vaccinated. The next slide is my one new slide for this week. We understand that there is a need to make it more clear for people who want and need the vaccine where they go to get the vaccine. This is part of the challenge in building an entirely new network to deliver novel and innovative vaccines that we previously didn't have. So this is our first attempt. It will get better from here. This is the first attempt. On our website, under the healthcare tab, only for healthcare personnel, please. This is not for the general public. This is for healthcare personnel only for the next few weeks, please. I've said all along it would take all of January to reach most of healthcare personnel. If later today you go on the website, KY COVID-19, and you look under the healthcare tab, there will be a new map. And in that map, when you click the link, you can find locations. If you find one nearest to you and you sign up, I don't know whether it will be within the next week or 2 weeks, but they will take your name and they will allow you to register and you can get scheduled for your vaccine. So we have guaranteed to provide a steady supply of vaccine. It's not as much as I want to supply. We get 53,000 doses a week, every week in the state, and that's likely to stay that way well into February. There's only so much to go around, but we have committed to supplying these locations with at least some steady, reliable supply so they know how many appointments they can schedule. If you consider yourself healthcare personnel, that does include doctors and nurses, but also social workers and therapists and people who care for vulnerable people in home-based care, hospice workers. It includes dentists and hygienists and psychologists and podiatrists and optometrists. It includes health sciences students, medical laboratory workers. I'm giving a long list so that if you think you are a healthcare personnel, please identify yourself as such, register, and go get the vaccine. We are trying to prioritize that as much as possible, but every site is to use all their vaccine within 7 days of getting it and at least hit 90%. Before I step down, should I mention the other couple points? I want to emphasize what the governor said. I think that the rise in our test positivity rate is very concerning. I think we definitively stopped. We halted the third climb before the holidays. I feel very confident about that, and I think the data shows that very soundly. I think, unfortunately, over those two holidays back to back, what ended up happening is people socialized and they spread disease in ways that are now resulting in an increase in our positivity rate. Our hospitalization data suggests that there could be the beginning of a new increase. We know that hospitalizations probably follow around 2 weeks or so or more after the positivity in the new cases. So we will now see over the next few weeks how bad it gets. I urge you, please wear your mask, wash your hands, keep your 6 foot distance. And please, if you are sick, Stay home. Do not go out until you feel better or unless you need to seek medical care, and get tested. If you believe you've been exposed or think you have COVID, please get tested, be informed, and take the necessary steps. My final point for today is, though I've been pretty overwhelmed with the vaccine rollout and obviously still overseeing some of these other operations, I am certainly at least peripherally aware of the activities of the legislature. And I would just caution all Kentuckians, please, this is a time for you to exercise your civic duty and to be informed. You can find the text of every one of these bills online at the Legislative, I think it's Resource Commission. Legislative Research Commission. You can find the text online. I urge you, when you see in the newspaper discussion about healthcare related and public health related bills, to go and read those bills. I think if you read some of them, you would share my concern. Were some of those to be passed, we would have I'm absolutely confident, had much worse outcome at this point. I would be standing here with the governor. We would be announcing much higher death tolls. We would have had same or worse economic harm, and arguably it could have been worse. Our hospitals would have been overrun by this point, like they were in the spring in some places, the summer in others, and right now in the winter. I'm standing here today able to tell you we've not had a single hospital collapse or get overrun this entire response, because we have responsibly navigated this and worked in partnership with you, the people of the Commonwealth of Kentucky, to keep yourselves and your neighbors and family and friends and loved ones safe. I urge you to be informed and to express your opinions so that your opinions are heard, because if we allow ourselves to be uninformed and not exercise our civic duty, I am concerned that some things could be passed that could make it very, very difficult for us to help work together with you to keep everyone safe and get through this intact and in a better condition at the other side. It remains a privilege to serve, and thank you for your patience with the vaccine, folks. 53,000 is 53,000. There's only so many ways to divide the doses we get. We're doing the best we can. We will get to everybody, but it's going to take some time. So thank you very much, Governor.
Now, last night in the State of the Commonwealth, I talked about the fact that we as a Commonwealth have learned that an effective management, an effective approach, an effective public health approach to this virus is necessary to sustain and rebuild our economy. In fact, just today, I read a news story about how one of Ford's plants, which employs thousands of people, is having to shut down because the virus has swept through one of the auto parts suppliers that it needs. Failure to manage and to have the tools in place for this virus is going to have significant economic impact, and just it's going to take us a lot longer to recover, but we'll talk about that a little more in a minute. Next is Adam Mather. He is with our Cabinet for Health and Family Services, and he is one of our point people on the long-term care vaccinations. Remember, this is 66% of our deaths, so it's absolutely critical that this piece runs smoothly, and Adam's working real hard on it. Adam?
Thank you, Governor. I also want to thank you in working with our national partners at CVS and Walgreens in respect to authorizing and initiating the skilled nursing facility and the assisted living facilities at the same time. That has allowed them to be considerably more effective and more efficient at distributing the vaccine to our most vulnerable populations. So, James, if you could pull up this slide for me, that'd be really helpful on long-term care. Thank you. I'll just go over these very quickly, and I'm sure there'll be questions at the end that I'll stick around for to answer. So when you look at the facilities that have been vaccinated thus far, we're sitting around 287. These numbers are from yesterday. There will be, in discussions with CVS and Walgreens, significant ramp-ups and a pledge by both partners to be finished by January 25th for skilled nursing facilities. You can see the doses administered are roughly a little less than 24,000, a pretty significant number, but we're looking to ramp that up with our national partners over the next couple weeks. And then residents vaccinated, we are seeing some differences there. Some of that is due to COVID outbreaks in facilities where they've been unable to vaccinate those individuals when they're on site for their clinic, but they are offering 3 clinics, and so they will be able to do that appropriately. And then, as the governor mentioned, staff vaccinations remain a bit of an issue. Some of that, a caveat to some of that is that some of the facilities have decided to split their staff in half in case there are any reactions or call outs that they have enough staffing. A note with that is we have not seen any significant call outs or reactions from the vaccination. And anecdotally, nationally, they've seen on the second round of clinics that staff are more willing to take the vaccine. So we should see a significant ramp up there. And hopefully in the next couple of weeks, we will see increase significantly. And with that, I will give it back over to you, Governor. I appreciate all your help on this project.
Thank you to Adam, and I know he's going to stay on the line. Just yesterday, Operation Warp Speed had a call with the head officials from the federal government. We had numerous people on it. The head of Walgreens and CVS were on it. It was very positive in that real commitments to do better, not shying away from the fact that we need to speed up, everybody accepting the task ahead of us. And that's the most important thing, is how do we improve day in and day out. All right, today's report continues 3 days that are very concerning. Today, we're reporting 4,750 new cases of COVID-19. This is our 3rd highest day ever in terms of new cases. These cases are all over, but they include 758 from Jefferson County, 302 from Fayette, 181 from Oldham, 171 from Kenton, 170 from Warren, 152 from Morgan. Right now, I believe that Morgan has the highest rate in the entire state. 145 from Davis County, 145 from Hardin, 111 from Boone, 94 from Campbell. You can see between those 3 northern Kentucky counties why this surge testing is so important. 94 from Campbell, 91 from Laurel, 88 in Boyle, 81 in Christian, 73 in Graves, 72 in Madison, 68 in Scott, and so many more with such high numbers that you can find on kycovid19.ky.gov. Our positivity rate is now up to 11.93%. We are basically at 12% after really being at about 8.5 for a number of weeks, showing that we're seeing a real bump after the holidays that we're going to need to address by making sure that we don't gather in that same way, making sure that we go get tested, that we isolate, that we really engage in social distancing. And just think about it this way. We've had the 3 highest days ever, which means it's the highest likelihood since this entire thing began that the people you're around have COVID. So please, please take care of yourself and protect yourself, and do not go out unmasked and expose other people. That is a reckless disregard for human life. Today, we are also reporting 13 new deaths, and it's 13 because we're doing this report earlier. If we were doing it at 4, there would be some that will be included tomorrow. That means we are now to 2,856 total deaths since this began. Almost unimaginable amount of loss. So please don't get tired. Light your homes up green. These 13 families don't get a choice for being tired. They're grieving, and it's our job, and it's part of our faith and part of our values to be there for them. Today's include a 91-year-old woman from Bath, an 81-year-old woman from Christian, an 88-year-old woman from Fayette, a 55-year-old woman from Grayson, a 78-year-old man from Grayson, a 64-year-old woman from Marshall, a 90-year-old woman from Marshall, a 79-year-old man from Marshall, an 89-year-old woman from Mason, a 60-year-old man from Mason, a 90-year-old man from Mercer, a 93-year-old man from Eulenberg, and an 83-year-old woman from Wayne County. Looking at long-term care, 82 new residents, 50 new staff testing positive, 4 new deaths attributable to long-term care. But look at that, over 2,000 deaths, long-term care residents and staff. That's why the program Adam was talking about is so important, and why we are pushing so hard on it. A little bit more tough news. The veteran with COVID at the Carl M. Beshear Radcliffe Veterans Center has died. He'd been transferred to the VA Medical Center, and he was on a ventilator. That means the total number of veterans to die of COVID at the Kentucky State Veterans Centers are now 37. These are heroes. These are people who fought to protect us, who went through tough times, that we failed, that we have failed. There's still a lot more, though, that are counting on us. And as I think back on one of my grandfathers, who's a veteran who served in World War II, he'd be telling us that it's not just a goal to do better, it's our duty to do better. He did his duty when he left his family to go to Europe. We can do our duty right here, right now, just by protecting the people around us. And then something that ought to just bring this close to home. You know, one thing I've heard at times is, I just don't see people who have COVID. I think now everybody is knowing someone who has lost someone from COVID. In fact, there was this story we saw today or last night on Lex 18 of one Somerset funeral home director who held 19 COVID-19 related funerals in December alone. For that city, for that community, how devastating is that? And this is going on in every community across Kentucky. Real, significant, irreversible loss of life, of friends and family, of parents and grandparents, of people that offer so much to our lives and to our community. The cost of failure, the cost of bad policy is death. We have to do better. All right, I want to take a moment because I know that there will be questions to address at least some of the legislation going through the General Assembly dealing with COVID, because it could have significant consequences. I want to start by this concept that I've been hearing of the executive branch doesn't consult with the legislative branch. Well, consultation is actually worked into the process of the 3 separate branches of government. Over the last 10 months, that process has been used over 40 times when we have gone to committee hearings. That's when our experts, including Dr. Stack, go. They give presentations, provide data, give information to the committee before the hearing, and then they are asked question after question after question after question, over 30 hours of testifying and questions over the last 10 months alone, showing up every single time, given all the information. So I think it's important to know that while the word consultation is being used, what's really at issue is control. I mean, all the questions that have been asked have been answered right in front of a committee where some of the same people who are saying these things have been asking the questions and having the appearances. I want to talk about one bill specifically and the harm that these can cause. So House Bill 1 is an attempt to replace all of our executive orders with a law written by the legislature. And what it says is basically things stay open no matter what if they're following, quote, CDC guidelines. Well, Dr. Stack and I can tell you there is a lot of different CDC guidelines. There's one for individuals, there's one for all businesses, there's one for certain types of businesses. There's guidance that has changed on almost a daily basis. In fact, the business guidance still references the reopening plan for the country in May. And that reopening plan written into The guidance that would become law says that if we've got cases going up instead of 2 weeks of cases going down, things should be shut down. And this is the problem when you would put guidance that is never intended to be law into law. House Bill 1, based on what it references, may be requiring a shutdown of Kentucky, which does not and should not need to happen. But those are the words that exist in the guidance. Here's another one. It says to avoid crowds. Being in crowds like, and this is the CDC telling you where you can get COVID in a crowd, like restaurants, bars, fitness centers, or movie theaters, puts you at a higher risk for COVID-19. So if this is instruction that goes into law that you have to avoid crowds in restaurants, is House Bill 1 saying that restaurants have to be open, but people aren't allowed to go in them? That they're not allowed to actually let people in, but they can be open? That makes no sense. And right now we have very specific guidance on specific capacities, on how to handle the food, on what to do, on masking. This then creates the gatherings. This says that you should avoid group events. Well, what about all the facilities out there that can provide group events? Is a basketball game in Rupp Arena or the Yum Center a group event? And would the inclusion of, quote, CDC guidelines into law prevent any of those things that right now we believe we are managing? Here's an interesting one. The CDC guidelines on there's multiple different ones, but one of them on business appears to require paid sick leave. So by passing House Bill 1, is the legislature now going to mandate paid sick leave during this pandemic? This is what happens, and it's why these types of bills are incredibly dangerous. Here's another one. The CDC right now is saying in their guidance, which becomes law, if passed, given the potential for a rebound in the number of cases or level of community transmission, which is occurring right now, a low threshold for reinstating more stringent mitigation standards will be essential. So this bill not only would bring in a set of oftentimes conflicting, sometimes vague, but in many times very strict guidance that could be debilitating for things that we can do safely. But it also prevents us from providing clear advice and having the flexibility we need to address a virus that just mutated. And are we going to give the CDC now the ability on an ongoing basis to change law, which this would be, when sometimes they've gotten it wrong and we had it right? For instance, when they were talking about less testing of asymptomatic people, and Dr. Stack and I stood up here and said, they're going to reverse that guidance and we can't get behind. We need you to continue to be tested. And guess what? The CDC came back and did the same. Every piece of guidance, every action we've taken has had different support from whether it's Dr. Birx, Dr. Fauci, Dr. Stack, the American Medical Association. It has stood up in front of challenges in front of the Kentucky Supreme Court and the U.S. Supreme Court. At a time we are surging, we shouldn't give away our ability to respond to the federal government. We shouldn't reduce our flexibility to where we would have less ability to respond than just about any other state in the country. I've shown you exit polling from this last election, the election that elected many of the people who are here in the legislature. I've shown you recent polling that is out there. A wide majority of Kentuckians support the actions that we're taking. It doesn't mean that they support or that they'll vote for me. It's that they know we're doing the very best we can, and Kentucky being 41st on new deaths right now shows it. That'll change if we don't have the same tools. All right, next we have, I think, an in-depth update on unemployment insurance, steps that we are taking right now. So this one is being provided by Amy. Over to you, Amy.
Thank you, Governor. As the Governor said, I am giving you an update on unemployment insurance. I'm going to give you a little bit of an update about our claims processing. some information about the Continued Assistance Act that was signed into law back in December by President Trump, as well as some more information about the stimulus payments that the governor introduced in his address last night. With regard to claims, of the almost 1.5 million claims that we have received over the course of the pandemic, only about 90,000 initial claims across all 4 of our programs have unresolved issues. But to put that into context, a number of those claims appear to be fraudulent. We can't verify the identity of a number of those, and these will never pay out. So we believe that the true number of claims in the outstanding initial claims group is actually approximately 30,000. Only about 5% of claimants have outstanding initial issues, and about a quarter of those filed in the last 3 months. So we've made a substantial effort in getting rid of the early pandemic backlog. If we can go on to the next slide. We are very proud to have paid benefits to more than 90% of claimants during the pandemic, partially due to the new pandemic-related programs, where prior to the pandemic, our average payment rate was only 75%. This is because, as everyone and has been explained before, these programs have very set criteria. So just because you apply doesn't mean that you are going to qualify, but we are very happy that we have been able to get benefits to more than 90% of people who have applied. If we want to go on to the next slide, I'll tell you about the updates for the Continued Assistance Act. As most people may remember, the CARES Act set up some pandemic-related unemployment programs, and the Continued Assistance Act does exactly what it says. It's continuing some of that assistance. So we do have an 11-week extension of the Pandemic Unemployment Assistance Program for the non-traditional and contract employees who have lost income because of COVID-19. This gets people up to a total of 50 weeks, up from the 39 weeks that expired at the end of 2020. And it will allow some claimants who had previously exhausted their traditional UI benefits some continued benefits. We have an opportunity to regain the extended benefits program that we lost back at the beginning of November. And there is now going to be an 11-week supplement of $300 a week for all claimants. This is similar to the $600 a week that was that Congress had given during the spring and the summer. That was a big help to our Kentuckians as well as to our economy generally. Now, of course, as you would expect, all of these programs require some computer programming on our end and require us to go through a lot of guidance documents from the U.S. Department of Labor. We have 80 plus pages of single-spaced documents to go through, and we don't even have all of the guidance yet. So once we get all of that guidance, we can, and analyze that guidance, we can get the computer programming done and process those benefits and get it out to people who we know are hurting. Keep an eye on the Kentucky Career Center website. We'll give you information there about both the timing of when these benefits will start to pay out and how to reopen your claim. If you had previously exhausted your total of 39 weeks, you'll be able to reopen for the additional 11, and there will be information there about how to do that. Now, a couple of other just additional issues. You may remember that early in the pandemic, we had some issues with some mistaken payments being made to claimants, and now they have been asked to pay those back. As you know, the governor asked us to find a way to forgive those overpayments because those were our mistake, not yours. The Continued Assistance Act actually amended the federal law and allows us to waive those, but state law doesn't at this time. So we are hoping the General Assembly will give us the flexibility to waive those payments while they are here. I know they have announced their willingness to do that. So we look forward to working with you to achieve that so that we can begin to waive those overpayments. And then I want to tell you about the stimulus payments that the governor announced last night. We are working on programming to get those stimulus payments out. They will come in the same manner as your regular unemployment payment, so you don't have to do anything. This payment, there's nothing to apply for. If you qualify, it will automatically be made. There's two different types of payments. One is $1,000 to people who filed their claims from the beginning of the pandemic through the end of October, but haven't seen any money yet, and we can verify your identity or there's no indication that the claim is fraudulent. So I mentioned at the beginning, because of all the money related to these pandemic-related programs, we have a flood of fraudulent claims. So that's part of why it takes us so long to process these claims. But for those of you who are real living and breathing people and who are waiting for an answer, that means that you need some help. So the governor has authorized a $1,000 payment to each of you, and that should go out next week. We are also have a $400 payment for two different groups of people. You might remember the FEMA Lost Wages Program that was active back in August and half of September, but unfortunately the presidential decree that set that up didn't allow us to pay that to people who had a weekly benefit of less than $100. Kentucky's minimum benefit is $39. So some of our neediest citizens were left out of that program. The governor has authorized a $400 one-time payment to those claimants, as well as claimants who are currently drawing a weekly benefit of $175 or less. Those of you who are getting small benefits, we want to get you some extra help, and this payment should go out next week also. Please watch the Career Center website for updates on timing and more specific details about those payments. Now, just two small final updates. If you are getting your benefits on a prepaid debit card, please check the notice on the Career Center website about the upcoming change in providers. There's going to be a gap between those providers. So if you don't change your method to direct deposit to a bank account, you're going to get a paper check for a certain amount of time. If that's what you would prefer and you want that paper check and not a direct deposit, please make sure your address is updated and correct with us so that check can get to you. And then finally, we are still doing only virtual appointments for UI assistants. We are not doing in-person appointments because of the COVID surge, but appointments are available on the Career Center website. And as soon as the COVID surge starts to abate, we will revisit and hopefully get some in-person assistance back to you soon. Thank you.
All right, so I know we've talked about a lot today. We'll open it up to questions. We'll start with Tom Latek from Kentucky Today.
Thank you very much, Governor, and good afternoon to you. In the vaccine priorities, you've got in the 1B, you've got K through 12 staff and faculty. But the state's public universities are not in that. Where do they appear in the priorities?
We got Dr. Stack coming up for that one.
So all the other educational personnel, by any definition, fit in 1C with all the other frontline essential workers. So, and I'm glad you asked that, Tom, because I want to be really clear about this. Folks are frustrated. We get that. There are a lot of people who want to be vaccinated. Only so much vaccine to go around. If anyone knows how to make more vaccine and is able to get it, we'll gladly take it if it's FDA authorized and approved so we can use it. But please, please, please don't devolve into this Lord of the Flies mindset where I got to crawl over you to get what I want and that somehow people are being deprived. We're going to go methodically as we can, but we got to prioritize getting all the vaccine out. So the reason we have to wait for K through 12 is we probably need 85,000 to 100,000 doses to cover that population. I only get 53,000 to work with every week. That means I can't commit to getting everyone covered by having them haphazardly go wherever they want to. So in counties where some teachers have been told you can't go get vaccinated right away this week, or that the program isn't operational, no one's being disadvantaged. We have committed to guaranteeing we'll figure out a way to do that. But then for all the other educational community, along with all the other essential workers, which by the way is 87 million other people per the United States government in that is essential worker bucket, you'll all be in 1C. We'll make vaccine as widely available as we can, and then you can just sign up and go get vaccinated.
Sarah Ladd from the Courier-Journal.
I didn't see the mute go on.
Yeah,
Mute's
thank
not
you.
on,
So
Tom.
I have two here, if that's okay. And the first might be more appropriate for Stack, I'm not sure. So we were hearing from some people in Daviess County that some people over 70 and older were being told to just come on in and get vaccinated during the 1A phase. So we're hoping to kind of clarify, how much autonomy do local health departments have to bypass the state's vaccine tiers or make their own distribution decisions? And then the second part is, given the last couple of days and the records we keep seeing, does the state plan to take any new actions to try and curb those numbers? Appreciate it.
So with regards to local autonomy, everybody has got to follow the phases, but you have to get 90% of the vaccine you have in somebody's arm within a week. So what we have said is if you don't have enough people scheduled and you have vaccines sitting there, you can move from 1A to 1B if you can get it out quickly. And so we're going to see some of this. We're probably going to see some school districts even going earlier than others, depending on the amount of vaccine there, how many people in a community may be saying no that are in 1A. So we're asking folks to follow the priorities, but to hit that goal, and if doing it means that they jump from 1A to 1B for a period of time, that's fine. Now they got to continue to try to sign people up from 1A, and they can't jump to 3 or 4. But that's the speed that we are now seeking, and we're seeing this across the country. We're seeing in most places giving strong goals, strong priority guidance, and then saying get it out. And then the other question is it's going to take a couple more days for us to see the data. We're very concerned with the last 3 days. The day before that was really low. We'll really need to see if this is a big bump from just 1 or 2 times that people got together and how much it spreads. If we do have a mutated strand, which is something that the federal government may be suggesting, we just need to see more data. But the most effective thing people can do is wear a mask and social distance. What we're trying to message here today is dangerous out there. This is for your own safety. We need everybody doing it. Karen Czar from WUKY.
Thank you, Governor. I have a few unemployment questions. The first is, would it be possible, a lot of listeners have requested getting weekly reports as to how many claims remain, much like we get on vaccinations and the numbers. And the other is we have several anomalies that don't fall into these categories of investigation. Like we talked about this last August, somebody who got their debit card and no money has ever dropped, or people who've been approved, but they've never gotten a check or anything. They don't know what to do and they can't get a hold of anyone. What should they do? Thank you.
Thank you. We're working through those issues each and every day. We'll send it over though to Amy, who's working on a day-by-day basis in it.
Yes. First, with respect to the weekly reports, we are actually working on a new reporting matrix to give you more and better information about what is outstanding. Unfortunately, and this is kind of just the nature of what we have been dealing with the whole pandemic, is as the governor said in his speech last night, the unemployment system had been cut to the bone prior to the pandemic. And we are also saddled with a very old and arcane computer system that dates back literally to the 1970s. Coupled with between the budget cuts and the arcane system, we have literally 3 people who can do computer programming and also pull us the data that we need to give you the information that you need to make sense of the sometimes conflicting numbers regarding claims that are out there. So what we are doing right now is obviously we are prioritizing getting the money out that has come through the Continued Assistance Act, as well as the new program that Governor Beshear has authorized for the stimulus payments. We have some of the data already looked at to try to give you more information, but we're going to start putting that out in a weekly manner, probably on Thursdays, to give you a little more detailed information about those, about the claims information. Now, with regard to these anomalies, that unfortunately too is a quirk of the system. Some people, the way it's set up, if you apply and choose the debit card option, that debit card comes before you're approved. So no money is going to go on that card unless and until the system works its way through and money gets on there. Likewise, we often find that claimants who get the initial letter saying that if you qualify, that means you will get X dollars, think that's an approval, and then don't understand why they don't immediately get X dollars. So some of it's an information gap, but some of it is often just mistakes in claims where things have been approved, but there is a glitch in the system. For people who have these issues, we know it's frustrating, but the best thing you can do is right now sign up for one of the virtual appointments, which will give you a very specific time that someone from the Office of Unemployment Insurance will call you. That is your time, and so that we know you're available and you don't miss your call. So please sign up for those appointments, and then you will get an operator who will call you and assist you with your claim.
Next is Stu Johnson. Stu, are you there?
Yes, I am. Can you hear me now?
I can.
Thank you. Thank you, Gov. A story that we followed the last couple of days, and my news director has asked me to ask you about. A city commissioner from Richmond attended the pro-Trump rally in D.C. that devolved into the riot at the U.S. Capitol. This public official posted pictures of her and a large crowd at the rally on social media. As a top public official for the Commonwealth, what is your response to her decision to attend a partisan rally with speakers asking the crowd to fight to overturn the election?
I don't think she was attending a partisan rally. I think he or she was attending an un-American rally, a rally that turned into a mob, that turned into a domestic terror attack on our Capitol. For an elected official to be challenging the lawful election of our president is so concerning. Anybody who was at that rally turned riot, turned domestic terror attack, even if they weren't part of the second two, needs to really rethink their values. That was not American. It was anti-American. America isn't, I get what I want whenever I want, regardless of how the election goes. We are a nation of laws, not a nation of bullies. You do not get to use your numbers, your violence, your intimidation to get what you want. And it's time that we start treating some of these groups for what they are. And just remember, a lot of people went up there saying they're pro-US and they're pro-police, and then they attacked the Capitol Police, killing one. We had a group of people that said they were fighting for America that attacked our law enforcement, killing one. That just showed you what it really was the whole time. You were at that rally, shame on you. John Boyle from WFPL.
Hi, Governor. So we're about 2 weeks out from Christmas. So logic would tell us that these high numbers are a result of gatherings then. But I wanted to see if the back-to-back shortened weeks with testing could also play a role in the past 3 days. And then I wanted to also see if it's your view that we can expect to see similarly high numbers as we finish out this full cycle since New Year's.
I think that the 2 weeks and the testing and how it came in could make some impact. But the size of this definitely shows that gatherings around Christmas, and some of them could already be New Year's, have made an impact. And we won't know how large the impact is until we have several days for the data to work itself out as we look back on the time when not as many labs were reporting. So yes, it could be creating some variance, but it doesn't explain all of it. And the increasing positivity rate, again, shows us that we're dealing with an escalation. How much of it is already from New Year's that we're seeing depends on how many people went and got tested, how many days after it. We still will probably see some more from New Year's if people got together the same way on New Year's as they did, it looks like, over Christmas. And sadly, we won't be able to tell you that until we see the numbers in the amounts of COVID. So we're watching, but all those points have validity, and we'll be watching as it bears out in the numbers. Melissa Patrick, Kentucky Health News.
Hi, Governor. So what efforts have you made, if any, to get the Republicans to revise their bills aimed at reducing your emergency powers? And is there really any hope of that happening?
Well, certainly those debates have been going on, and we'll have an opportunity after seeing what does or doesn't pass. We have not been invited to testify on bills that tear powers away from the governor. So it really raises the question of, did you want consultation or just control? The bills that we're talking about are unconstitutional as well. Do we have the piece from the last Supreme Court case? Now, the last Supreme Court case where the Attorney General challenged the powers of the governor, which, by the way, they were filed in Scott and Boone Circuit Courts. So to suggest that all the constitutional cases are filed in Frankfurt is just false. Absolutely talked about responding to an emergency being an executive function, and talked about the implication in the Constitution of it being constitutional. So, should that pass, we're certainly going to veto it. Should the veto be overridden, we'll do what the branches of government are supposed to do when they disagree. We'll go to court. That shouldn't be dramatic. I think everybody expects that. It's a civil way to work this out. We don't have to have rhetoric that goes around it. But to me, it's not only an important power of the governor as commander in chief, but it's absolutely necessary if we are going to defeat this virus, to be able to be flexible in how we do it. Certainly, a lot of these arguments are being heard from certain members who disagree, who are on the floor. Fortunately, we seem to be seeing votes that just fall along partisan lines. So I hope people will listen to the logic and the reason and the input that's out there. Chris Otts from WDRB.
Thank you, Governor. Questions about unemployment. Indiana tells me that they will start paying the additional $300 a week that's part of the new stimulus bill to regular UI claimants on Monday. So what is your best estimate for when Kentuckians will start seeing the benefits authorized by the new stimulus bill? And I've gotten a ton of questions from people who are confused about what they need to do, if anything, to receive those continuing benefits. Should they file a new claim, et cetera?
Great. We'll go to Amy for that, but I do want to we want to make sure we do it right. We got bitten pretty badly by the federal government giving us guidance to go at the beginning of this crisis, and then entirely changing their guidance. And that's why we did payments to people. Initially, they said yes, and later said no, and now we're saying we have to go and collect from. This guidance hadn't been out there very long, but I want us to be as fast as we can while doing it right. And I don't know, Chris, and you can look at this about Indiana's IT system, but man, to have a system that you got to code just to get the numbers of claims, and we show 80,000 outstanding claims when we think it's really about 30,000, but we can't even dedupe claims the way you need to, has been a great challenge, one we're working to address and one the budget addresses. But let's go over to Amy.
Like the governor said, we want to make sure we get everything right. So while we think the extra 300 a week will be one of the earlier things we start pushing out, it will take us, it will definitely not be coming Monday. We think it won't be too long, but we don't want to give you a firm estimate now until we finish getting all of the federal guidance, which we still don't have yet, which is understandable from their perspective because this was signed on December 27th. There were some new programs set up. There were some amendments to the current programs, and this came out it's smack in the middle of the holidays. So we are doing our best to get this out as quickly as possible, but as accurately as possible. So short version is the 300 should be fairly easy to code once we make sure we're good to go. It'll be one of the first things pushed out, but it will take some time. Now, as far as the new programs or the extended programs, if you had not run out of benefits, and we can confirm this and give more information on the website, if you still had weeks of eligibility, you shouldn't have to reopen or do anything. If you had gotten to a zero balance, you will likely have to go in and file your new claim. But again, we'll put that information on the Career Center website. And this is for people who were drawing pandemic PUA, the Pandemic Unemployment Assistance Program, or the PEUC, which was the Pandemic Extended Unemployment Compensation. Those were the ones that were the 39 weeks. If you had maxed out and had zero benefits there and you were still out of work, there will be 11 more weeks and you will need to go back in and either refile or reopen those claims. But we'll get that information on the website.
Detailed questions, send them in to us. The ones from the other day on the CARES Act program, I think were real helpful for clarification. John Charlton from WHAS.
Hey, thank you, Governor. I appreciate it. I'm sticking with the unemployment theme here. Just for clarification, the $1,000, that doesn't need legislative approval, correct? And on top of that, it sounds like there are 90,000 claims unresolved, but you believe it's really just 30,000 and because of all the fraud involved. How do we know about that fraud, and especially people who've been waiting for a phone call to go through their claim to be accurate on that 30,000 mark? And last question, EY contract I asked you on Monday, are they sticking around?
Yeah, we're still considering on the EY contract, and we hope to have some news on that in the coming days. We have not entered a new contract with them as of today. The $1,000 and $400 payments to those that have waited too long or made too little to get the summer benefit are all through the CARES Act. That doesn't require legislation from the General Assembly. And now we'll go to Amy for the other piece.
There has been, as we had said, a tremendous amount of fraud around but especially the federal programs that were instituted during the pandemic. And one of the things that we do to try to prevent that fraud is require some fairly stringent identity verification. Not everyone who fails the online identity verification is a fraudster. So all claimants are given the opportunity, if they fail the automated identification process, which is very stringent. And so we know that a lot of people do fail that. If you fail that, you're given the opportunity to provide your ID documents to prove who you are, because that's our primary source of keeping anyone who is filing a fake claim from getting those claims paid out. The 60,000 or so of the initial claims are ones who we cannot verify their identity. The vast majority of those are ones that we have been asking for ID documents since March, April, or May. So at this point, if we don't have ID documents, there may be a few people in there who just have had trouble submitting those, but we believe the vast majority of those are probably our fraudulent claims and are never going to pay out. So that other 30,000 are ones that we do have identity documents. We know these are real people who are properly connected to an employer or they're self-employed. And then we are still working through other eligibility issues. So those are the people that we know are real, honest to goodness living claimants, and that we are going to get that $1,000 to.
And I'd just add that even if the number is 30,000, it's too many. It's too many Kentuckians that have been waiting for help for a long time. So we're not satisfied until we help everyone. And I know those workers in UI are working really hard. Scott Brown, WKDZ Radio and Katie's.
Thank you, Governor. We've talked with several people who are waiting for payment on an initial claim or have been placed into a call queue to talk to someone because their claim didn't go through, or they say the COVID claim process is different than the process they may have completed before. What's being done to help minimize the queue time for callbacks, and has the state considered other virtual options such as Zoom conferences or webinars to maybe address the basic complaints that can further minimize callback delays? And has any timetable been discussed or certain COVID criteria discussed in reopening the regional UI offices to maybe help with that? Thank you.
I know we're now doing virtual appointments that folks can sign up for online. I think the point's well taken about webinars. We have certain videos that are up. Sometimes those that are struggling, access to some of that can be difficult. About in-person services, we were providing them. We almost had our entire workforce, or a large part of it, wiped out for a period of time because of it. And right now we're seeing our driver's license offices closing one after another after another after another for COVID. While virtual meetings aren't the optimal, they do ensure that we have that workforce continually healthy, not out with this virus, able to get through as many claims. And now we'll go over to Amy so she can correct anything and everything I just got wrong.
Oh, no, none of that at all was incorrect. I can just add a few things. Again, often the people who are having the most trouble, sadly, are ones who do not have internet access. So some of these virtual options are more difficult for them. To top that off, public libraries are often their source of internet access, and that has now been restricted because of COVID, which is a very difficult circumstance that we know a lot of claimants find themselves in. That's why a lot of these virtual appointments are by telephone. It is easier for people to use, and you can sign up for them through a web browser on a smartphone. On top of that, if you do have internet access, we have a chat bot on the website that you can use. One of our upgrades that we're trying to roll out in the next few months is an enhanced chat bot that can help guide you through that. So hopefully with some of these different tools, people can get the help they need. We know it's difficult, but we really do want to get you the help that you need.
In response to Karen's question earlier, our goal is to not only have an update on numbers every Thursday, but also an update that we'll present during these briefings. Larry Smith from WLEX.
There we go. All right. Can you hear me now? Excellent.
I can.
Okay. Thank you for your time. I appreciate it. You and I talked a month ago, and seeing again with unemployment, and kind of piggyback off the last reporter there. I'm still talking to so many people that are still not getting that phone call. As you know, we've sent a lot of names to you, and your office did a great job to reach out to a lot of these people, but we still have a lot of them who have not even received a phone call and feel like they're in the same spot they were months ago, or even back at the beginning. You say there is the chatbot on there. Is there anything else that people can do in terms of trying to break through and get that phone call, or get that email, or anything to kind of take it a step further? And my second piece of this, you said that the $1,000 is for those who have not received anything yet. What about for those people who have received some assistance, but there's still some money they have left in their account that they're trying to get access to? Thank you.
Right, and I appreciate that question. We're at a point where we can't provide dollars to everybody, and so we had to make a priority, and that priority for us is those that have been waiting for a couple months and haven't received the first dollar. Our goal is to address all of these challenges, and again, whether the number is 80,000 or 30,000, it's a lot of people who need help. I want to bring Amy back in because I want her to go over this virtual meeting and how to sign up. Because getting in the call queue, I know has been around for a while, but getting a specific time that you are assigned to an individual in the office is certainly better.
Yes. If you go to the Career Center website, and I believe it's because of some new announcements, it's about two-thirds of the way down, there is a spot where that says UI assistance or sign up for UI assistance. I apologize for not having it off the top of my head. If you click on that, it will give you, it normally can give you options of virtual or in person. And right now, since there's no in person, you will then click on the sign up for virtual assistance. And then that's how you can go in and get a time set up to have someone call you from the unemployment insurance office.
And given that I'm governor, I'm going to make sure that that's put on the top of that page, Amy, if you will convey that. And let's make sure we also put that on kycovid19.ky.gov so it's as easy to find for everybody as possible. Christian Hauser from WKRC, CBS in Cincinnati.
Hey, sir. We have a decent stretch of no holidays where we'll have these get-togethers and whatnot, like Christmas and New Year's and even Thanksgiving just a little over a month ago. If the positivity rates continue to stay as high as they are, what's the threshold to where you will look to shut down restaurants again, shut down bars? Obviously this high rate here is unsustainable if we want to control this virus at all. So just wondering what you and the staff will look at in terms of more restrictions, more shutdowns, that sort of thing.
I appreciate the question. Before the internet goes crazy, let me just make sure I say we don't have any plans at this moment for any of those steps. It is still very new in the data. The data looked really good a week or so ago, going in a better direction. So we need more time to see it. We need to see where it's going and to talk to experts like Dr. Stack and on the federal side about what they believe could be causes, whether it's a mutated strand, whether it's these private get-togethers. We also need to look at a little bit of the data to try to get our best determination of what people are doing. When we have meetings here in the Capitol, do they stay separated or do they come close together? Are people watching and engaging in social distancing? What does it look like, the operations of restaurants and bars and retail? Are we actually enforcing the mask mandate? And so I think we need a little time in the coming days to see what New Year's does, and again whether this is something potentially short term caused by everybody just saying, well, I'm willing to do what it takes normally, but I want to get together with some people during either of these two holidays, or whether we've gotten lax again overall, and that would be something that we would need to know. All right, last question, Victor Puente from WKYT. Victor, are you there? All right, why don't you send us your question and we'll get you a direct response. All right, I know today was a different time. It was a lot of information, and our goal is to provide as much of it and stand here and answer as many questions as possible. Since the beginning of this virus, we have provided hours and hours and hours every week of information, the best information we can. We think we've been transparent about when we don't know something. We're going to continue to do these because of how quickly things can move in fighting this virus. But everybody, there should be no argument that there isn't huge amounts of information out there that are being provided, whether it's the hours and hours and hours of these that are all archived on Facebook and others and can be watched, whether it's kycovid19.ky.gov, which if you go to has so much information, or whether it's from committee testimony or the rest. Almost every day questions are being answered, even when we sometimes don't have the answers yet. So we talked about how far we've come in testing and vaccinations just in the last couple days in PPE. But I want everybody else to know out there that we are doing the absolute best we can to answer any and every question in an open way every day. So we look forward to continuing to try to keep you informed. We'll be back Monday at 4. Just remember, everybody, that we got to defeat this virus, but we've also got to restore the soul of this country. Never thought I'd see Americans attack their own capital, and that's what happened. And moving forward, we cannot accept, we cannot rally with, we cannot allow this type of behavior. I mean, breaking in to your own capital, killing a police officer charged with protecting it is the opposite of being American. It's being an enemy of America. Thank you all. We'll see you on Monday.